How to feed the young child with care. Giving a child his best start depends not only on what and when a child is fed, but also on how he is fed. A baby thrives when a caregiver responds to her feeding signals, encourages the baby to eat, and creates a positive and loving environment during her meal. This video shows how to feed a young child with a warm and interactive feeding approach that helps him develop close emotional connections and healthy, lifelong eating habits. Guide the caregiver to respond to her baby's feeding signals. When she shows signs of hunger, such as her hands at her mouth, have her feed her baby promptly. First, she positions her baby so she has eye contact with her, and then feeds her slowly and patiently. Throughout the meal, encourage the caregiver to interact with her baby and encourage her to eat. She makes the meal a happy time. Have the caregiver watch for signs her baby is full and content, then stop feeding. In this example, the baby starts to fuss and cry when she's offered more food, indicating she's had enough. The mother responds by calmly taking the rest of her food away. As her child gets older and wants to feed himself, the caregiver can give him food he can pick up with his fingers or with a small spoon. Encourage the caregiver to stay with her child through the whole meal, interacting and encouraging him to eat. This communication makes the child feel valued and well-loved, helping to form a bond of trust. It's normal for a young child to eat slowly and spill his food as he develops the skills of eating. She helps her child until he can manage the food by himself, making sure he eats until he's had enough. Be sure the caregiver doesn't hurry her child. The more practice he has at feeding himself, the sooner he'll learn how to eat on his own. It's important to watch for and respond to the child's signs that he's had enough food. This helps a child develop his natural ability to determine his food intake based on his appetite. Sometimes, children refuse to eat when offered food. Here are some possible solutions. First, have the caregiver feed the child when she sees feeding cues, when she is truly hungry. Next, if the child refuses many types of food, try different food combinations, tastes, and textures. Or give the child healthy food that he likes and introduce other foods more gradually. And last, minimize distractions during meals. Have the caregiver feed her child in a quiet place, setting her in front of her to keep her child's attention. Don't force the child to eat or be too strong in urging her. Instead, be calm and accepting. Give the child positive attention when she does eat, but don't make it a problem when she doesn't eat. Just take the food away, cover it, and offer it to her again when she is hungry a few hours later. Some caregivers feed their children in ways that can be harmful. These feeding practices can cause young children to develop unhealthy eating habits and poor emotional connections. In the first example, the mother dominates the feeding situation, often overpowering the child and forcing him to eat. He may refuse to eat and cry during feeding. This can lead her child to have negative feelings about mealtimes. Hand feeding is an extreme form of controlled feeding. The feeding process is entirely controlled by the caregiver as she forces food into the child's mouth at the amount and pace she chooses. Besides being harmful to the relationship with the child, it's a dangerous practice. The child can choke and breathe food into her lungs. This can be fatal. Next is a neglectful feeding style. Here, the mother doesn't interact with the child at all during feeding. She is uninvolved, ignoring the child, giving very little physical help, and is unaware of when and what the child is eating. The caregiver ignores the child's signals of hunger and fullness and has little interest in the child's nutritional needs. The child learns to eat whenever food is given to her rather than when she is hungry, and can learn to eat past when she's full. She eats whatever food is there, regardless of its nutritional value. Last is a permissive feeding approach. The child controls the feeding situation. Here, he refuses to eat the healthy meal his mother is offering. So she gives in and lets him eat the junk food he prefers. The caregiver is often indulgent or may use food as a reward or to control a child's behavior. The child is left to decide when, what, and how much to eat, and often has a high intake of junk food that he learns to demand. When you recognize an unhealthy feeding practice, use your counseling skills to help the caregiver make changes. Here, a new mother is feeding her baby too forcefully. After asking the mother's permission, the nutrition counselor demonstrates a warm and interactive approach. The mother watches closely how eagerly her baby eats when the counselor interacts with him. She tries it herself with better success, now convinced to change her approach to feeding her baby. Remember, how a child is fed is just as important as what they are fed. The child will thrive when the caregiver responds to her feeding cues, encourages her to eat, and creates a warm and interactive feeding experience. When young, feed the child slowly and patiently. When older, help them learn to feed themselves.